frente a ti, me está mirando de que lado, porque se ve más natural.
Tiene que ser.
Sí.
Sí.
Ustedes quieren ver acá.
Hola, hola. ¿Cómo están? ¿Cómo están? Ok. Ahora le vamos a dar la bienvenida a nuestro doctor, que era para las 11:30. Pido disculpas de nuevo porque se presentaron situaciones ya como médicos que son. Y vamos a iniciar ahora con el doctor Oliver Diaz, que es especialista en manejo de heridas. Esta sí va a ser en inglés, para que todas mis chicas puedan entenderlo y puedan hacer sus preguntas en relación a lo que son sus cicatrices, heridas y todas esas curiosidades que tienen. Una bienvenida formal al doctor Diaz. Hola, hola doctor.
Hola, ¿cómo está?
Bien, ¿y usted?
Bien, bien, gracias.
Muchas gracias por recibirnos acá el día de hoy.
A ustedes por su tiempo, gracias por tenernos pendientes, sobre todo esas chicas que están viendo, que tienen quizá mucha curiosidad, ¿no?
Sí.
Así que nada, bienvenidos y gracias.
Vamos a dar una pequeñita reseña de usted en inglés.
Como no, claro. Hi, my name is Dr. Oliver Diaz. I studied medicine at UNIVE. Decided to go through, advanced wound care management. After I studied medicine, I started in the United States with American Wound College, and then went to Puerto Rico and also did hyperbaric medicine in Chile.
Okay.
Good, doctor. So now that we know a bit of your background, it will be nice for the patients to know about your field of expertise. So, in the field of plastic surgery, which is what most commonly we are with, what are the type of or kind of wounds that you might be found in your practice?
Yeah, that's a good question. Actually, wounds, there are a lot of wounds out there. But if we circumscribe what we're talking about plastic surgery, we can, all wounds in plastic surgery are clean wounds because there's a patient that gets prepared before surgery, it's a clean cut with a scalpel and, and stitches. And usually what you see after that is when there's a complication in those type of surgeries. You see, you see that the wound can open after surgery because too much pressure on the sutures. You can have abscess. You can have also too, when you have a lot of fluids on the wound, it tends to open it and and loosen the borders of the wound. That's basically what you see in plastic surgery. You can see also some kind of burns, depending on the procedures, and the burn. Actually, when there's a burn, you have different tissues that get affected, which then with the plastic surgeon, you need to make a team and an effort to treat those kind of patients and go step by step from the simple to the most complex of the wound. That's basically the ones that you see in plastic surgery complications.
Okay.
And also when a wound gets infected, also it tends to open, and borders get weak, and it opens the wound and it starts draining.
Okay. So now that we know that the wounds in plastic surgery are supposed, in most of the cases, obviously, to be clean. But what are the factors or circumstances that may not allow the wound to be clean, or at least to recover normally?
Okay, well, if you see patients that, plastic surgeons, they have a whole team specialized before, to evaluate the patient before going to surgery. The cardiologist, pulmonary doctor, endocrinologist. Wounds, those wounds get complicated because the patient had a predisposition factor. In case an example, diabetes, patient with diabetes, patient with high blood pressure, patient that smokes, patient that drink alcohol in excess, all of those things tends usually to weaken the tissue, and that's when you get a complication, and the wound tends to to open, probably not to heal the way it has to heal, and those are the main factors of those kind of patients that you can see.
Right. So in that regard, as you said, that's pretty important why to have or know previous conditions. So in that case, if you have a patient that has a condition and actually present with, let's say, complication, what will be the proper handle of the wound without a complication And in the most common cases that you can see, what's the handling of the wounds?
First, that's a good question. First, you need to evaluate the patient. As soon as the patient gets out of surgery, the plastic surgeon is on top of the patient. She's, evaluating her. First day post-op, probably 3-4 days post-op, and if there's no signs of redness, heat on the tissue, probably some secretion, the wound is perfect. When you start seeing changes on color of the skin, redness, when the tissue is hot, then there's a concern that the surgeon needs to get and evaluate, evaluate the wound and scrutinizing what's going on there, and also going back to the medical past history of the patient to see any conditions, as I mentioned before. Yeah. Some patients they stopped smoking 2 years ago, but for a patient to be, let's say, clean of the cigarette, he has to go back years without smoking. So there's a risk factor there. So the surgeon has to go to the past medical history, also evaluate the scar, the wound, any changes in color, as I mentioned before, and then handling the situation, taking what we call advanced wound care of that situation.
Okay. Usually, and it's pretty common, right, these days, with the advent of hookahs, e-cigarettes, and smokers. In that kind of case, what will be the handling of the patient? What will you do to treat a patient with a complication with that precedent?
Before the complication,
could be to preempt it, of course. Yeah.
Okay, actually follow the patient in a daily basis. That one needs to be followed every single day to see if there's any changes. When you have an alarm, you have changes on the tissue, then you need to treat it different ways.
Okay, good. So in the case of a wound that is already, let's say, closed, the scar tissue is already formed. Usually there's a fear of the patient to develop keloids or hypertrophies of the area. What will be the caregiver or the care that the patient must have after the wound is already closed?
Well, keloids and hypertrophic wounds are real common on patients. It has some genetic factors behind it. You can prevent keloids, you can prevent hypertrophic wounds, but you can treat them. Actually, the surgeon, when you have a keloid, they can remove the keloid, stitch the wound again, and use some kind of medications to prevent the keloid to form again. But there's no guarantee that the keloid is not going to form again, even if you, cut it off and do stitches again. You have medications that can lower and soften the tissue, and it can look better, going through the aesthetic view of the wound.
Okay. So since we already spoke about the possibility of complications, some patients have a time schedule, like they have some time to be here. Obviously that time is going to be extended because of a complication. But in your opinion as a physician, what will be the time that a patient will need for a complicated wound to stay here in the country?
Usually when you start seeing complications is first week after surgery. After that, if you don't have any complications, what you can get with time is probably keloid, a hypertrophic scar, but that's pretty much. You see complications at the beginning. You can have some cases that even though when they go back to their country, and you can form probably an abscess, you can have what they call, you can accumulate fluid, and that's probably, it's going to get your complication probably 1 month, a month and a half after your surgery.
Okay, good. There's something that's pretty common in the case of liposuctions, and those are the burns. Could you please explain to patients what will be the mechanism of how a burn can develop on a patient with liposuction, and what will be the treatment?
Actually, after liposuction, when you start seeing changes in color on the skin, that's an alarm that the patient needs to be aware of and communicate with her plastic surgeon, which is my first recommendation. Whatever you see on your skin, if there's any color change in the color, you communicate with your surgeon, because he will be the best person to know what to do after that. Okay, but when the burn is there, it has started a process that you cannot stop. there's some treatments. Actually, there's a good one which is hyperbaric oxygen, the hyperbaric chamber, that can help you with oxygen concentration to the tissue to get more oxygen to blood flow, and probably save that area to spread wider. But as soon as the burn is there, you need to, let the burn to do the process, and then start treating. Nice clean of the wound, observation. You measure the wound, and I highly recommend hyperbaric oxygen.
That's pretty important because time is of the essence, and usually patience is needed from the patient. Talking about patient, there's a wound complication that is not common, thankfully, but it can occur especially in patients with tummy tuck, abdominoplasty, and it's the necrosis of the flap that is already created after the tummy tuck. So can you please explain us more or less what will be the process when it starts to present itself, and what to tell the patient when it happens?
It's good to know, before answering your question, it's good to know that the tissue, the blood has to deliver appropriately to the tissue. That's where the tissue gets, your blood supply. When you have surgery and you have the flap, usually you tend to lose some of the microcirculation you have there. So, as I mentioned before, first thing you're going to see in the tummy tuck and the scar is changing color. That's the main alert or sign that you need to be aware of. After that, tissue is going to suffer, probably is going to go deeper, and then just the surgeon probably has to not perform surgery again, but remove the tissue that's damaged, and then start treating. Doing some, cleaning the wound in an appropriate way. Probably use some creams or some kind of medication to soften the tissue and to see what tissue can regenerate after the damage is there.
Okay, there's something pretty important that you said, the regeneration of the tissue, because it's going to depend, obviously, the size of the damage. So what's the time that a patient can expect? Obviously, depending on from case to case, but what is the time that the patient can expect from a full recovery after the process is identified?
It depends the size, depends the treatments. Usually I have some patients that heals in 20 days. I have patients that heals in 3 months. It depends the size and the therapies that you use. There's some really nice modern therapies. I can mention one. It's negative wound treatment, negative pressure wound treatment, which is it helps stimulate the cells to grow faster. Okay, and promotes the microcirculation to form new vessels and get more blood supply in the area, which is going to help you heal faster and the cells to replicate and produce new tissue. But it depends. It depends the size, it depends the depth of the wound, and it depends on the care that you have and the care that the surgeon has with the patient.
In some cases, there are patients that now that this kind of service is being, getting known, is there a way in which a patient before surgery, if it has any conditions, could contact you so you can evaluate them and verify what will be the risk for them before the surgery?
Actually, they can contact me. I'll always be available. But the main point here is that the surgeon has to scrutinize on your history. You need to be honest with your doctor in any medical condition you have, any social habits, anything that you do. You need to be specified to your surgeon, because that's the person that is going to be following you up before and after the surgery. I can gladly evaluate you, but that won't even change the risk of you to develop a complication of your wounds. I highly recommend also with the hyperbaric before surgery, which is going to be better for you because your tissues are going to be more fresh, because they're going to have a nice oxygen supply to your circulation.
Great. We already talked about burns, about process. Now it will be a good time to ask about infections, but in this case, localized infections in the wound areas. What will be the handling, and what will be the best advice that you will give to the patients regarding it? Not to alarm them, because it's a good known fact that when a patient speaks about infections, they actually get a lot of alarm or worrying about it?
Yeah, well, actually, they alarm because, I mean, when you tend to develop infection in your wound, it's something that, you start thinking about, oh, I'm going to get complicated, what's going to happen to me. Infections are pretty common localized, in the localized area. What I recommend is first a nice evaluation of the wound, redness, heat of the wound, any secretions on it. When you have any secretions on it, probably you need an incision and drainage of the wound. Take good care of it. Not you at home. Go to your surgeon. Follow find a service and wound care specialized doctors that can treat you. Starting with the most simple thing is, wash out the wound and then evaluate. And if you need to do incision and drainage, drain, take cultures to see what is growing there. Okay, then to start a proper antibiotic therapy, which is going to be indicated by your doctor. Or in case that I follow your patient, so I will indicate the culture, I will indicate the antibiotics, and follow the wounds at least every 48 hours.
Now, more into the area of the follow-up. You know that patients after surgery, they can take baths, like strictly said, water all over the body. So, upon what time a patient can start having their bath, and what cares or what instructions should the patient follow for those baths?
Well, good question. Actually, I tend to leave the question to the plastic surgeon, but if you're asking, when your scars are fully healed, usually 21 days, it's a perfect time to take a full bath. But that will be your plastic surgeon that will give you the answer when you need to take a full bath, because that's the doctor is going to be following you constantly until you leave the country, or even if you're in the country until you finish with the treatment.
Okay, great. Um, in cases of patients that they're having complications, usually it has happened. It's not a desirable thing, but if they have had problems with infections or any other or burns, how can they contact you? Because sometimes their surgeons are not available or they have communication problems, but they need specialized help regarding that. What will be your contact? How can the patients contact you directly?
Yeah, they can contact me to my phone number directly and also my Instagram page, Dr. Oliver Diaz. You can find me there. There's my phone number and my email. You can contact me there, and I'll be gladly. I mean, I will help you gladly, and also I will gladly to communicate with your plastic surgeon, which is the first step when you communicate to me any problem that you have. Because I need as a doctor to be in communication with your surgeon to see what happened before, what happened after surgery, and what we can do or work together to do a proper care of your wound and take you out of the complication as fast as we can.
Great. So in that regard, where are you located? Like, what's your consultation located? In what clinics or hospitals do you work?
Okay, yeah, in Centro Médico Moderno, I share a consultation there, and also I do ambulatory care, which is more proper for the patient that can even move. So we have a team that we go to your houses, we go wherever you are, hospitals, clinics, and we move there because we know and understand how hard it is for you to move. After surgery with the pain and la faja and all that kind of stuff. So that's why we build a team, a specialized team that we go visit you wherever you are, and we work together with your doctors to take you out of your complication in a proper way.
That's a great feature to have ambulatory service. Well, let's see.
Any questions?
From the girls.
It's new for all the patients. The Dr. Oliver, yes, but okay. Any advice for the patient after leave to the country after surgery?
Yes. First thing is, you need to try to be your doctor's best friend, okay? Because that's where you're gonna start avoiding some complications after surgery. Have a good line of communication with your doctor, and when you travel back home, that you're fully recovered, of course. Always try to, take care of your wounds, look at it, any change in color, any change in size, any pain, any kind of, sensibility in the area. That's those things you need to have in mind, and to just to be aware of if anything's going on. And in case that there's going on, please contact your plastic surgeon and work it through that.
Okay. Fue un placer para nosotros, doctor, tenerlo en esta entrevista. Esperamos tener una próximamente ya con muchas pacientes que van a comenzar a escribir por el tema que es. Muchísimas gracias por su tiempo y que tenga un feliz resto de la tarde.
To you, gracias a ustedes y a toda la audiencia. Thanks for watching. Any questions, just feel free to contact us anytime.
Thank you.